was aware that this debate was going on about how what the advantage of starting treatment early was. There was, I believe, a lot of talk coming out of the States that treatment should be started very early. There was another school of thought that treatment should be started as late as possible. Certainly it was interesting to, I've obviously got quite a few nursing and doctor friends, and there was certainly split views amongst them about, should I do this, should I actually start treatment or should I not? And I can remember a friend from me saying, I'm really not happy about this, I really don't want you to do it. I really don't think you should be putting your body through it when there's no clinical evidence that you need it. I thought, if I'm going to do this, I would like to go on to meds and see what happens. So I would have been very disappointed had I had the one that I think was the placebo or no treatment. I think there was one arm of it was no treatment, one was a very short course, and one was what I got. So I was actually very pleased.
I was petrified of having to go onto medication because I just felt that that would then define me as being a person with HIV. I just thought, if I have to take medication, that's going to remind me every day. But actually, it was a trial, so I knew that whatever arm I was randomized to, that would be okay. I was on the 3-month one in the finish, and that was fine. I think I was more worried when I came off it at that stage, because the 3 months had gone really smoothly, and my CD4s had risen, and I was thinking, this is okay, I can do this.
Most individuals that I saw wanted to take medicines because they wanted to feel that they were in control of this virus. Okay, some individuals had a lot of symptoms with regards to their HIV infection, and they would think that potentially taking this medicine would resolve a lot of those symptoms. So I think a lot of individuals were much more keen to go ahead to take medicines at this time.
Well, I knew that there were all different categories, and I really didn't have a preference because I knew that it was random, so it didn't occur to me that it made too much of a difference. But when I found out that it was a 12-month selection, which is the longest that was possible, my initial thought was that this is absolutely great because it just means that I'm going to get 12 months more information and 12 months being looked after at what I thought was really a critical time, which was, I only have a short time to live.
Most of the participants, I think they felt happy that they were going to receive the ARVs because they were told in the beginning that this is just a trial. At some stage they have to stop those ARVs. So they were happy that maybe these ARVs is going to prolong their life.
I believe that it brought a hope for them because after seroconversion, I believe that it's normal for one to feel like because now I'm HIV positive, I'm going to die. But when they heard that they were going to be given a treatment, ARVs, so that brought a hope for them that they might live longer than they were expecting, that maybe they will die early.
As soon as somebody seroconverted, we essentially had 2 to 3 months to recruit them and enroll them in the Spartak trial. A lot of them were still coming to terms with their status, so they had a lot of difficulty accepting that they were HIV positive. A lot of them were not ready to disclose to anybody in their family or friends. A lot of them were not able to understand the concept of taking ARVs so soon after seroconverting, especially while still being healthy.
One of
the classic questions which people ask when they test positive is, if I have HIV, then shouldn't I be taking medicines? One has to explain that according to the Brazilian guidelines, you have to wait for the CD4 count to fall or for other symptoms before starting treatment. In the trial, we did it differently. We had 3 randomly chosen groups. One did not take treatment early, another took 12 weeks of treatment, and the third 48 weeks. But even with those people who said they wanted to start treatment straight away, there was always a psychological impact if they did indeed end up in one of the treatment groups. It was a reminder of the news when they were first told that they had HIV.
The trouble is, it does emphasise that I am a sick person if I'm starting on treatment, and I think that is one of the biggest fundamental questions about whether somebody should start treatment early or not. For me, it wasn't an issue, but I could see how it could be an issue. I think if there's very clear clinical evidence that the outcomes are improved by starting treatment, then I think we should be working to help people with that psychological barrier. But I think while the outcomes are still questionable, I think that's a difficult one.